The trial was a multi-center phase 3 trial that was conducted globally. And ultimately, the patient population, I would say, is quite representative of what we see in clinic. In terms of the primary endpoint, pathologic complete response, there was a delta benefit of 11% favoring the Trastuzumab Deruxtecan, followed by THP arm versus AC-THP. I would call this a clinically meaningful advance in pathologic complete response rate. That is why I started by saying I think this is practice-changing data. But I'm sure we'll talk a little bit about the adverse effect profile and so forth, because of course there are considerations as we think about applying this to our patient population.
Now, what about the control arm? You know, it had an anthracycline. Is that the right choice of the control arm, do you think, or could it have just been TCHP?
Yes, well, as you know, I've trained on the East Coast, and part of our East Coast, West Coast discussions, which I'll inform the viewers, have been anthracycline versus non-anthracycline